Welcome to Tech Talk with WSU Tech, where we dive into all things WSU Tech and we highlight the voices within our college community. I'm Dr. Sheree Utash, and today we have the honor of chatting with DeShaun Willingham. Welcome, DeShaun.
Thank you.
Thanks for being here, and we always like to start with this. Introduce yourself and tell us about the role that you have and how do you serve the mission of the college?
Well, again, my name is DeShaun Willingham, and I have the pleasure of serving as the Dean of Nursing for WSU Tech. We serve the mission by educating and bringing forth nurses who are ready day one to take patients when they go into the different facilities, whether it be long-term care, acute care, the doctor's office, community nursing. We make sure that their education is well-rounded and they're ready to take on those patients day one.
So walk us through the nursing pathways, because there are many, and the ones that are available at WSU Tech.
Okay. So there are several different pathways to become a nurse. So we start, most people start at the certified nurse aide level. And so once they know that they kind of like that a little bit, they may progress to becoming a certified med aide, which we have both of those programs at WSU Tech. And then the next level is the licensed practical nurse, and we have that program. So the licensed practical nurse program at WSU Tech is both a full-time and a part-time option. The full-time option is 10 months. The part-time option is about 18 months, but it allows students to work during the day and go to school in the evening to fit their schedule. In that program, you have to be a CNA in order to apply to our program. Then we have a LPN to RN bridge program where the students have to be an LPN. It's a really popular program. We have quite the waiting list for that. And then we have our traditional RN program at WSU Tech that takes the 2 years, the 4 semesters, but the 2 years. And so we're really excited about that because in January, we get to open up a brand new class of nurses.
That is fabulous. So not only was that your recent news, because that just happened at the Board of Nursing meeting in June that we got approval, correct? Mm-hmm. But we also recently went through an accreditation visit for our ADN program.
Yes.
And what happened?
Well, we had a very wonderful visit. The surveyors that we received were from different parts of the country, and they were very complimentary of our program, of our staff, of the administrative support. And so I'm glad to say that we received full accreditation with 0 deficiencies.
That is a huge, huge accomplishment.
Huge.
On a brand new program.
On a brand new program.
Yeah, that's a big accomplishment. You've had a big year.
Yes.
You and your team have had a big year.
Yes.
Let's talk about nursing. So, COVID happened and they were essential jobs, which we already knew. Now the world knows, right?
You're right.
But that also led to a lot of burnout of healthcare professionals. And that's terribly understandable under the circumstances. So how has the nursing field changed in the last few years, and how are we evolving to meet the demands of workforce and to recruit students to do this very noble profession?
COVID was quite the game changer. What we already knew going into COVID that we would end up with, we would need to replace a number of nurses as baby boomers start to retire. And so, schools, more programs started to pop up. But during COVID, the demands and what people actually saw began to wear on their mental health. I'm glad to say now that mental health, as far as the nurse burnout, is now a topic, and most facilities are very active in making sure that nurses have what they need in order to continue to care for loved ones at the bedside. It's very much needed because we tend to take on those roles depending on where we're at in the hospitals, and we don't really say anything. We suffer in silence a lot. So it's good to see the mental health support come and just kind of the work-life balance talk come to that. Where we're at now is that we have now introduced technology a lot more at the bedside to help the nurse and alleviate some of those staffing loads. And so we get to be a part of it at WSU Tech because we have very innovative technology that we use within the classroom as well as in the clinical setting prior to students ever setting foot in anyone's facility to get those students ready to be able to work with the technology at the bedside.
So you mentioned the support of mental health, and the one thing that we didn't add to the nursing pathway, which is outside of that, is the new program that you're overseeing in mental health. You want to talk about that a little bit?
Sure. Thank you. So really, I get the pleasure of introducing it, but really, if it wasn't for the work that you did in the background, we wouldn't be here. So I would like to thank you for that. The Licensed Mental Health Technician program is something that we're bringing back. The Licensed Mental Health Technician has been around the state of Kansas for since the 60s. And so as nursing programs evolved, kind of the licensed mental health technician just went away. There were a few, but not very many. COVID was another precursor for this program in needing the added support at the bedside and in also community settings. And so we were approved last June seems to be our month, at the Kansas State Board of Nursing to start a licensed mental health technician program that will actually launch this fall. We have 10 more spaces available, and it's a 3-month program if you want to stop at the technical certificate, but you're more than welcome to get the associate's degree as well. And so we're really excited about that, especially with the new mental health hospital in Southwest Wichita and being able to supply the workforce that way.
And we have a lot of industry partners with this.
A lot of industry partners that are very supportive. And I mean, almost daily, I'm getting more calls of people who want to be a part of that program.
That's really cool. I'm super proud of that. And thank you for everything you did to get that across the finish line. Really anxious to see those first graduates come through and to see where they end up going.
Yes.
So when students come into any of your programs, what can they expect from the learning experience at WSU Tech?
They can expect innovative education. We attempt to meet the student where they're at. And so we employ a lot of different technologies. We are blessed to have supportive administrators who give us the dollars that we need to do that in the classroom. And so the nursing program has a high flex classroom that allows for students, and if they're working parents, they can still attend school. And the technology is just absolutely fabulous in that classroom. It's like they're sitting in there. We also have VR simulations, so the students are able to put on their VR sets and they're able to take care of patients in different multi-care settings. We also have our simulation hospital where we have high fidelity mannequins who use case studies and they're able to act out those roles and really be in a psychologically safe environment prior to even going out to any facility. And then just the added support and the wraparound services that we have at WSU and at Tech at the South Campus, which is the tutoring, the mentoring. Trio. It's just very supportive of the student nurse.
So what motivates you as a dean of nursing? Because you've had 3 years?
2.
Two. And we've done an awful lot.
We've done an awful lot.
So what motivates you as a dean of nursing, and what do you find as the biggest accomplishments for the work that you do?
I really enjoy the pinning ceremonies in December and May to know where those students came from and the stories and sometimes the things that they've had to overcome to even get there. It is it's touching, and oftentimes I have to stop because I have to choke back. Just the tears to see how beautiful they are sitting out there in their white, and just being able to know that I played a part in removing the barriers to help them achieve their dream, but also to help add to the workforce.
It is a very moving, emotional ceremony. It always is. But the thing that I find so interesting is when they come across and they read, you read that short amount of little statement from that student and those family members or their children, their spouse, their partner, their friends, whoever it may be with them, and how they call them out. And I love the fact that so many of them call their kids out and say, you know, I did this to be a role model for you.
Yes.
I think that is, I mean, that's got to be just a huge bucket filler for you.
It is. We've had several stories in the nursing program, and it just, you know, when they come in, because oftentimes I don't see them necessarily just for them to say hello, even though I tell them my door's open, and they share their stories. You know, at that moment, I have to decide on how to deal with it within our policies, but what can I do to help them achieve their goal? And so we make sure that we tie into student support services and referral to Charlie and to his team to come in quickly so that you know, the student can feel the support. That's what's important to me, is that they're just not out there kind of going to school and no one cares. I want them to feel supported, and I want them to know that we're just as invested in them as they are in getting their degree.
It's very important. It's very important. So they're not the only ones with a story.
No.
And you told us a story right before we started today's podcast, and I really want you to share that with all those that are listening today because it's powerful.
Okay. What I shared, we have a 60th video on the WSU Tech website, and as I was watching it, there was a building that stood out. And I remember going to this building as a little girl, picking up my grandmother, who at the time was in nursing school to become an LPN. And she started nursing school after my grandfather passed away as a second career because she was a stay-at-home mother. And she started it so she could take care of her family. And just she had 8 kids, and just in trying to get her kids where they needed to be, she was told that if she was late one more time, she would not be able to complete the program. And so she was late, and she just never went back. But coming full circle, now her granddaughter is the dean of the nursing program that she attended.
And how did you fall in love with this profession?
And I fell in love with it because I would watch her iron her white uniforms and polish her white shoes. And I would go and visit the nursing home where she worked and watched not only her colleagues, but the patients respond to her. And it just lit something inside of me that I followed in her path.
She would be really proud of you today. I'm absolutely quite sure. And my comment back to you was how important, as grandparents and parents, what a responsibility we have that little ears and eyes are watching us all the time, and the effect that we can have on their careers and their lifetime. So yes. I really thank you for sharing that. It's such a cool story.
Thank you.
Such a great story.
Thank you for letting me share it.
She would be very proud. She is very proud.
Thank you.
So let's talk about, you have had a lot of big wins. You have built an incredible team.
Yes.
And I want you to just have a chance to talk about your faculty and the team that you have built.
So the faculty, they're absolutely phenomenal and have bought into the vision of student success. And so on the RPN side, we have a faculty member who has worked as in long-term care. He has worked in agency, and so he's in our foundations class, but he also has the flexibility to move. And so this year we're moving him around a little bit, and he's going to teach our leadership courses, which we think will be phenomenal. our nursing care of adults 1 teacher, that's MedSurg 1. She is absolutely phenomenal in meeting the students where they're at. And they play games. You should come see it sometime. Sorry, Jeopardy, Family Feud, different ways to try to get the content across to the student, and knowing that lecture just isn't the only way. Our pharmacology teacher, she's the same way. She actually rebuilt the pharmacology class within the outcomes, so that our students had more access to names and names of medications and classes, so that when we sent them out, they had more of a foundation that way. And then we just added 2 new faculty members on. One came from the ER, so she has a breadth of experience, and then another that will be teaching maternal child. On our ADN side, we have an instructor that has been with Tech for a while, Joy Thompson. She just received her certified nurse educator certificate. So we're really excited about the experience she's going to bring with us. And then Emily Preston, and she came from surgery and post-op. So really excited about her. Then we have our ancillary staff, which is Shelby Pineda-Allen, and she works as our clinical coordinator. And she's done a fabulous job in establishing relationships with our partners and getting us into new facilities. And then Tessa Brock is our simulation coordinator. She comes with an MSNI, so she really is all things tech and loves it. So anytime there's something new, as a matter of fact, right now she's working on the AI part for the nursing program. So we're working on different things. And then, of course, you got to have a partner in crime, and that's Flora Diaz. She is the assistant dean and program director. And so sometimes it's scary how on one mind we are, And so there's times we don't say anything to one another, and we're thinking, like, I told you that, but I thought you were in my mind. So she's been fabulous, and she was really instrumental in leading the effort with the accreditation. And so just really grateful to work alongside of consummate professionals.
So stay tuned for the AI pilot, because it's coming out of the Department of Nursing.
Yes.
I'm very excited about what the pilot looks like and what happens. But I want to thank you and all of your team for all that you're doing to create this talent pipeline of healthcare professionals. We all need them. We all will use them throughout our lives. And I feel very confident in what's happening in the nursing department and for our students that are having the opportunity to go through these incredible programs under your leadership. So thank you very much.
Thank you. It's our pleasure.
Thank you for tuning in to Tech Talk with WSU Tech. Be sure to subscribe so you never miss an episode. And until next time, stay connected and keep exploring the incredible work happening here at WSU Tech. Thank you, DeShaun.
Thank you.